This is Impact Healthcare.
Attention. This podcast has been disrupted.
Welcome to the recap episode for the Dysrupt Healthcare Podcast. This is the second one we're doing, and the reality of it is this is a new strategy. These are tidbits and sound bites from the longer episodes that you could listen beforehand to figure out if you even want to listen to it, or if you want the Reader's Digest, or maybe, you know, the kind of podcast host's thoughts of that episode, whatever tickles your fancy. So we had Heath Potter, the Chief Growth Officer at 6 Degrees Health, on. 6 Degrees Health is one of the leading reference-based pricing RBP providers. Now, when I said the word RBP, if you are in this business, you are an advisor in this business, you got a feeling. You got some sort of feeling inside, and that feeling either was love it, hate it, or man, I've been meaning to learn a little bit more about it. Let's go with the hate it. It's interesting how many advisors, and because I work with advisors across the country, I see all types of people with all types of opinions and feedbacks around reference-based pricing. And what's really interesting, when I hear that feedback, my immediate question back is, tell me how many of your clients are utilizing a reference-based pricing solution. A high percentage of people will tell me none. But somebody in my office has done it, or if they tell me something, it is a fraction, and I'm talking a small fraction of their overall book of business. And the time period, it could have been 5, 6, 7 years ago. So for any advisor who has a negative thought about reference-based pricing, I need you to take a step back, and I need you to look in the mirror and ask yourself, why do you have this negative sense? Is it because your organization feeds you that information? Well, if your organization, given that I have worked for one, is a publicly traded company who gets paid off of commissionable dollars or gets paid off of the override that's paid typically by the major insurance companies, could it be that the organization has a little bit of a vested interest to keep the strategies and solutions that are in your face constantly being promoted, the ones that drive up the revenue for the organization? I am not saying people wake up in the morning trying to screw their clients. What I am saying is, my mom taught me a long time ago, if you want to understand people's pure motivation, follow the money. And so if you feel a negative way, I need you to ask yourself, why do you feel that way, number one? And number two, how many have you done yourself? Have you played in the mud? I have implemented hundreds of reference-based pricing groups, and some have worked well, and some, I wish I was missing teeth because I've gotten my teeth kicked in. We had one in Pennsylvania that the first 2 years ran like a champ, and the third year they got a new CFO, and that CFO opened every single case that was paid in a non-BUCA environment. I've had one in Houston that they were billing 1,800% of Medicare and wanted to go to court and fight that. But when I take all of the bad experiences, it adds up to less than 1% of total claims that have ever occurred. So I liken this strategy, and I liken this this conversation in theory very much to flying an airplane. I'm a executive platinum with American Airlines. I have been for the last 14 years. So I fly a lot. And people are like, oh my God, American sucks. Or insert carrier, here, right? Airline carrier. And the reality of it is, most airlines actually kill it. They do such a good job. When you take the number of flights that take off a day, the number of bags that they handle, the number of people that they have to deal with, and then you divide that into and compare that with the ones that screw up, It is such a small fraction. And we think about it, it's like, oh, I hate flying, but like, how many times do we get in a traffic jam driving? How many times does somebody cut us off? How many times does somebody give us bad directions? How many times are we late to something because of the weather or whatever? So reference-based pricing on a grand scheme does a couple of things really well. Number one, it brings transparency to the table. It uses a bottom-up rather than a top-down approach. If you don't know what I just said right now, it's a very key point of when your insurance carrier, the normal BUCA carriers say, we have a big discount, the industry forgets to finish that sentence. Discount off of what? You should be asking. Discount off of billed charges. Now, billed charges, for those of you that don't know, are established by a hospital or a provider off of what's typically called their charge master, and that is their fake overinflated costs. And I love hospitals. I have some as clients, and so I work with hospitals all day long. But everybody's stuck in kind of just the game. And the game is we got to bill this because we got to give a discount to the carrier at this. And then we got to chase a bunch of people's out of pockets. And then we finally get to this number. And so what reference-based pricing does is tries to put a basis of comparison of what the plan, the self-funded health plan, is going to reimburse for a service that's being provided. That's it. So the discount off of the billed charges is trying to get to the price. The Medicare-plus is trying to get to the price. Don't overcomplicate what reference-based pricing is. And so that's simply just the definition is getting to the price. Top down versus bottom up. Now, the reason I think Heath and his organization has done such a great job with this is they come out of the transplant world in which they were seeing all of this data and understanding, but wait a second, look at the egregious cost that's happening between what's actually the cost of this thing versus what's actually being billed and paid for it. And so light bulb moment is like, well, wait a second, like that's not fair. At the end of the day, almost 20% of our GDP, the number one reason people file bankruptcy, et cetera, is the pain in the rear of healthcare. Well, then, Heath and his organization started the fight of like, we're going to lower this cost because that's not fair. And we're going to do so off of a fair and collaboration model. It's not the we're going to pay you 120% of Medicare, screw you, we'll see you in court model. It is the we'd like to pay between here and here. We're going to start with the offer here. And if you don't like it, let's have a conversation. And we're going to show you some data of what we think the cost is. You can kind of rebuttal and let's get to a conversation and a price point that works for everybody. Obviously, they're hired by the plan, the employer, so their job is to represent the employer. But at the end of the day, if the cost of healthcare, let's just call that Medicare, and what a hospital typically ends up getting at the end of the day is over here, there's a lot of room in the middle to have a very fair negotiation. And that is why I like, the conversation with reference-based pricing and the models in which use data, provide some level of explanation behind that data, and it just allows the reality of a conversation, a scenario in which this number isn't take it or leave it and screw you, we're going to see you in court. And so, the interesting approaches behind this is that hospitals themselves, although you might hear organizations say, we don't take and we hate RBP, a lot of them use an RBP-ish way of administering their own health plan. Come into our doors, we pay a really strong percentage. Go over there to our competitor, we're going to pay 70% of usual and customary. You know what usual and customary is? That's taking the usual and customary and setting that as the reference point and paying 70-80% of it is the reference-based pricing of what you're going to allocate from a payment standpoint. So I think if we all sat in a room, employers, providers, advisors, and all of the plan administrators from the TPA to the reference-based pricing models, and we said to ourselves, hey, all we're trying to do is get to a fair price, and let's get out of the gamesmanship of this and just have real dialogue, it would work. The challenge of it is that's a hard, impossible, very Pollyanna type of approach to this. And so reference-based pricing partners like a 6 Degrees take the notion of we're going to start with a price. We think it's fair, but let's have a dialogue on it. And, the success stories that Heath shared, one, they're on their own plan. And so he's had conversations and he shared conversations about his wife wanting to go to a certain pediatrician that's never in network. Well, doesn't matter with reference-based pricing. Go where you want. He talked about his son's physical therapist company who happens to be a client of ours, and his son's therapist actually bragging about how great their health insurance program was. He talked about local employers, like down to the everyday mom and pop shop, being able to support and keep dollars in the community because of the ability to have a more collaborative, approach about reimbursing and getting to healthcare. Like, we all have seen it in the news where a Cigna, Humana, whoever is fighting in the news with the hospital. Like, no, you suck. No, you suck. And like, it's, I overpay you and you're overpaid. And all of these people are overpaid. And the reality of it is, who is getting the shaft end of that is the end member and the employer. And so when you think about it like that, the ability to add some transparency into the cost conversation and potentially do so through a more collaborative arrangement with particular providers and limiting the exposure on the ones that really don't play nicely in the sandbox is a really interesting approach. And so, at the end of the day, if you are an employer and your advisor is not teaching you about reference-based pricing, I think you need to consider another advisor. If you're an advisor and you have this negative feeling, I think you need to ask yourself, why? And I think, again, we need to get down to the fact that this is a collaborative conversation. And if we don't all decide that we are going to get on the same page, that it's all of our jobs to solve this, we won't have to solve it. The government's going to try to come in and solve it for ourselves. And I don't know about you. Me personally, I do not want to be in a someone's telling me when and how and what I could do to access healthcare model. And I just think that we could lead the charge. So take a look at this episode. One of the things that you will see in the show notes is the opportunity to get an impact analysis to see, like, how do these programs actually work? So Heath and his team will run an impact analysis. So I got to ask, like, what else do you have to lose? If you're an employer and you're like, I can't afford these rate increases that we continue to get, then the reality of it is checking out this strategy will allow you to see the comparison between left to right on approaches and strategies. And so just thankful that Heath and his team is super passionate about leading the charge. Take a look at the episode with Heath Potter, the Chief Growth Officer of 6 Degrees Health. Thank you so much for listening to the Dysrupt Healthcare Podcast summary episode. Share it with somebody, like it, give us some feedback. What do you want to hear about? And we'll keep producing it. Thanks so much, guys.